Hello, my name is Justin Lambert and I'll be speaking about vulnerable populations, more specifically childbearing adolescents under the age of 17. So the definition of a vulnerable population would be a people or group of people who are susceptible to harm and neglect. Now these types of people are affected by acts of omission or commission. Childbearing adolescents are at risk for a number of health problems related to pregnancy, which Amanda will be speaking about shortly. Epidemiological factors involved with childbearing adolescents would be low socioeconomic status, a lack of parenting, and lack of education. So incidence and prevalence rates I got from Pregnant Teen Help Organization. In 2000, the pregnancy rate for adolescents ages 15 to 19 was 93 per 1,000 in Hawaii, and the U.S. average was 84 per 1,000. So between 1992 and 2000, the pregnancy rate in Hawaii actually decreased 33%. Now, if you look at teenagers from the ages 15 to 17, the percentage was even steeper. It declined to 43%, which is a good thing. Every year, around 750,000 teenagers get pregnant in the U.S. So depending on the state, the averages kind of vary. Nevada was actually the highest rate at 113 per 1,000, and North Dakota is the lowest at 42 per 1,000. More than two-thirds of all teenagers who have a baby will not graduate from high school. So the following information was taken from a study done in 2001 by Durock, Singh, and Frost at Guttmacher Institute regarding percentages of women who have given birth before the age of 20. Now, U.S. is at 22%, Great Britain 15, Canada 11, France 6, and Sweden 4. Thank you very much.
Hi, I'm Amanda, and today I'm going to talk to you about some factors that contribute to the vulnerable population of teenage pregnancy. First of all, teens tend to view the world differently from adults, and many don't recognize any risk related to their behaviors such as alcohol or drug use, or anticipate any consequences of using them. They are trying to establish their own identity and are reluctant to listen to advice. Even the potential background disadvantages such as poverty or lack of education can contribute to them becoming members of that vulnerable population. Also, peer pressure heavily influences the social environment of teenagers. Teens are more likely to be sexually active if their friends are. Even peers may reinforce teen parenting by exaggerating birth control risks and glamorizing the impending birth of a child. Even a history of sexual victimization can influence a young girl's ability to exert control over future sexual encounters and make her less inclined to seek contraception. Another factor is an increased social acceptance of out-of-wedlock pregnancy today. All of these things are background factors that contribute to teenage pregnancy. Another topic has to deal with pregnant teens being considered high-risk clients, and they may face many health risk issues. During the formative years, bones are not mature and overall growth is not yet finished. And because of this, a pregnant teen could be at risk for spinal and pelvic bone injuries, which can alter her life forever. It is also well known that the irresponsible behaviors that some teens may exhibit can put them at risk for STDs. These infections can contribute to ectopic pregnancy, to premature labor, and also even low birth weight. These diseases can easily spread to an unborn baby, creating problems after delivery. Another health risk issue is that many pregnant teens neglect to seek prenatal care because they are either in denial or are afraid. Professional health care needed during the early months of pregnancies can help to reduce associated obstetric complications. Even nutritional needs during pregnancy can be challenged if the teenager has unhealthy eating habits and begins the pregnancy with limited reserves of vitamins and minerals. With education, the adolescent can make good food choices. These are things public health nurses need to keep in mind. Thank you very much.
Hi, I'm Edna, and I will talk about the community level resources for this population, as well as public health strategies to reduce the risk for this vulnerable group. Community-based interventions would include broad-based coalitions and planning councils to facilitate a more comprehensive approach to teen pregnancy. The groups usually include healthcare professionals, social workers, clergy, school personnel, businessmen, legislators, and members of other youth agencies. The public health nurse can play a significant role in influencing the health outcomes through interventions in the home or community setting. The nurses can help achieve compliance of good nutrition and prenatal health concerns. The Early Intervention Program provides a planned program which includes preparation for motherhood classes and a series of focused prenatal and postpartum home visits made by specially educated public health nurses. They also make monthly home visits for the infant's first year of life. Nurses in all community-based agencies can help adolescents access the healthcare system, as well as social services and other support systems like the food bank and WIC, Women, Infants, and Children. Public health strategies to reduce the risk for this vulnerable group would be to organize community assessments, public awareness campaigns, group education, and interdisciplinary programs for high-risk teens. This information has been taken from the 7th edition of Maternal Newborn Nursing by Olds, London, Ladwig, and Davidson, and also the 7th edition of Public Health Nursing by Stanhope and Lancaster. And this is the book, and here's the Public Health Nursing book. Thank you for listening. I hope you learned something.
Hi, I'm Karen Fay, and I'll be talking about the role of the public health nurse in helping out this vulnerable population. The public health nurse can promote primary, secondary, and tertiary interventions related to teen pregnancy. At the primary prevention level, public health nurses focus on educating young people about sexual practices that prevent teen pregnancy. For example, public health nurse works in a variety of settings, including homes and clinics, which provide them many opportunities to offer education and guidance about sexuality issues. A school nurse plays an especially important role in assisting with the development of reproductive assistance education programs. Public health nurses at the secondary prevention level focus on providing early detection of teen pregnancy. During assessment, nurses need to watch for and consider the possibility of pregnancy with teen girls. Findings might include complaints of fatigue, appetite, weight loss, nausea and vomiting, or missed menstrual periods. At the tertiary prevention level, public health nurses focus on counseling a young mother or couple about available options. They also assist with coordinating community and school programs to meet the many needs of student parents, such as confidential health services, financial, social, and family needs, a parent-friendly school culture, parenting classes, and mentoring programs and child care. Lastly, a public health nurse focuses on special needs of the pregnant teen population, including assessing for intimate partner violence, establishing early prenatal care due to a higher risk of low birth weight and preterm babies, and promoting proper nutrition and weight gain. In these many ways, the public health nurses are helping this vulnerable population.